women have already done the abdominoplasty, the tummy tuck, the lipo, and they walk away unsatisfied from the results. And when you delve deeper into this, it turns out that prior to having done the abdominoplasty or the lipo, they really had not lost any weight or sufficient weight. Could you please educate our listeners as to why that is important to first lose the weight and then do these contouring procedures?
Absolutely. Great question. I can't stress this enough in my practice. It seems like it's a daily conversation I have with basically every patient that I encounter. I want you at your best shape for surgery. And there's two reasons why I want to do that. Number one, when you lose that fatty tissue and you leave the plastic surgeon with excess skin, it defines for the plastic surgeon best what there is actually to do. So as you said, if we have to deal with, let's talk about tummy tuck, for example, just to kind of hit the issue where, where we can understand it. The reason why some people are disappointed with the results of their tummy tucks oftentimes is because there is an excess of fatty tissue in the upper abdominal flap. That's to say between the umbilicus, or the belly button, and the lower part of the chest. Now, you can remove that part of the lower abdomen, what we call the pannus, which is that part between the belly button and the private area, or the mons pubis. You can remove that, and sure, you'll get rid of the problem right there, but you'll still have this bulging at the upper abdomen, and that's not a good look. And as you mentioned, of course, that the reason why that operation leads to disappointment is because maybe there wasn't enough stressing on the actual weight loss before the surgery. So when you lose the surgery and you have hanging flaps of skin, and I always tell my patients, you can't embarrass me in the room anymore. Whatever name you call that piece of tissue, I've heard it before. The back wings over here, my apron, my extra tire. That's what we want to deal with. We want to deal with hanging pieces of skin so we can remove as much of the bad you away and keep only the good you behind. So that's the number one reason why we want to have the patient lose as much weight before surgery, so that we can define best what we need to do as plastic surgeons in the OR. Secondly, the second reason is, well, if you've done so much if you've done so much effort and hard work to get to the operation at your best shape, it serves the reason that after surgery, you're most likely going to do the same, and you're going to maintain the results and possibly even get better results as you continue down your journey of weight loss and maintenance of actual good health and vitality. So that's why I always tell people, listen, lose as much weight as you can. Leave the hard work in the OR. To me, the hard work outside the OR, that's got to be on you.